Varicose veins aren't just unsightly. They can become quite painful, and they are a symptom of venous disease, a potentially debilitating condition that can worsen over time.
So varicose veins are at the root caused by abnormal valves that are supposed to prevent the backflow of blood down the leg. And so what can happen is if those valves are leaky or if the vein wall gets a little bit weak, then the blood, which is trying to make its way back to the heart, is being pulled back down the leg by gravity, and so those veins can start to get distended, can get larger, and become weaker and even more enlarged and distended.
Most common symptoms are heaviness, achiness, burning, throbbing type pain. Sometimes it's worse at night, particularly after they've had a long day at work. Some of the veins can get inflamed and get hard, and it's called superficial thrombophlebitis, or just a fancy word for the vein has gotten angry and it's trying to close itself off. And oftentimes I tell my patients, well, the body is kind of trying to tell you, when you see a varicose vein, it's like the check engine light on the car, and it's been on for a long time, and eventually your body's going to tell you, okay, I've had enough. Then the body tries to fix it itself.
So varicose veins, if left untreated, could lead to worsening swelling, could lead to skin color changes, skin damage, skin thickening, and ultimately can lead to ulceration and tissue loss and skin breakdown, which can be really challenging to try to reverse at that point.
The good news is today, varicose veins can be treated without surgery and without downtime. The doctors and staff at Vein Care Specialists use an assortment of non-surgical and minimally invasive treatment options that are custom-tailored to every patient's individual needs.
At Vein Care Specialists, we offer all the state-of-the-art techniques. We do laser ablation and radiofrequency ablation, which have been around for the past 20 years. And we also brought into our practice VenaSeal glue closure, which is essentially just gluing the vein closed. We treat spider veins and reticular veins, which are the little clusters of pink or bluish surface veins that are oftentimes cosmetically disturbing, but can also be very painful and itchy.
During the outpatient procedure, the doctors at Vein Care Specialists thread a very small catheter through the skin and into the varicose vein. Once the vein is sealed, it shrinks and is eventually absorbed by the body and disappears.
We're introducing a catheter about that thick. It's a tiny little nick in the skin after giving a little wheel of local anesthetic. Just like you'd get a bee sting of numbing medicine at the dentist office, it's very similar to that. No major incisions, no major recovery, and no general anesthesia or sedation is necessary for these types of procedures. And typically it's a 15 to 20 minute procedure.
All procedures done here at Vein Care Specialist are covered under most major carriers for insurance. The only procedure that is not typically covered is sclerotherapy. That's considered more of a cosmetic procedure.
If you have varicose veins, we invite you to consult with the experts at Vein Care Specialists. We can help you find out if one of our minimally invasive treatment options will work for you. Call Vein Care Specialists today.